therapy?
So stem cells are broadly speaking of two types. Allogenic stem cells, which are stem cells that you get from the outside, and autologous stem cells. These are stem cells that we get from our own body. Now, allogenic stem cells are again divided into two broad types. You can get stem cells from the embryo, that is either from the aborted fetus or from test tube babies. These are called embryonic stem cells. You can also get stem cells from the umbilical cord, which connects the mother and baby at birth, and these are called umbilical cord stem cells. Now, embryonic stem cells are the source of a major controversy. There is a lot of ethical issues about it. They are also potentially dangerous. So, most people all over the world, we do not use embryonic stem cells because of the ethical considerations and because of the potential dangers. Umbilical cord stem cells in comparison are safer than embryonic stem cells. But the other group which I was talking about, that is autologous, this is the bulk of our work. These are stem cells we get from our own body. You know, our body is rich with stem cells, and there are some areas from where we can actually extract them. The most easily accessible is from the bone itself, and what we do is we put in a needle into the bone marrow and we can take out autologous stem cells. You can also get stem cells from the fat in our abdomen, and you can also get them from the teeth, the pulp of the teeth. So these are the areas from where we can get autologous stem cells. A new type of stem cell that has evolved is something called iPSC, induced pluripotent stem cells, where we take the body's own cells, which is autologous, and change the inside. And so these are autologous cells that behave like embryonic stem cells. And for this research, Professor Yamanaka got the Nobel Prize in Medicine just 2 years ago. So broadly speaking, they have allogenic, you have autologous, and you have iPSC.
So what are the three main neurological disorders that children face worldwide? Autism. Autism is a mental condition characterized by great difficulty in communicating and forming relationships with other people and in using language and abstract concepts. Cerebral palsy. Cerebral palsy is a non-progressive brain injury or malformation that occurs when the child's brain is underdeveloped. Cerebral palsy primarily affects the body's movement and muscle coordination. And mental retardation. Mental retardation or intellectual disability exists in children whose brains do not develop properly or function within the normal range. This is Ms. Ridhima Sharma. She's a psychologist and behavioral therapist working at Neurogen. So how do autism, cerebral palsy and mental retardation differ from one another?
Autism, cerebral palsy and mental retardation, as we all know, they are neurological disorder. Coming to autism mainly have different kinds of symptoms, like if we talk about main symptoms, then the children with autism have stereotypical behavior as in repetitive movements, repetitive actions, things like poor attention span, poor eye contact, poor cognition level. They are very hyperactive. Their social interaction is affected. I mean, they usually prefer to stay aloof and they don't mix up with other people. Coming to cerebral palsy, a child or any adult with cerebral palsy, they have more of physical issues like dystonia, spasticity. Coming to psychological issues, yes, they have cognition affected, but this is again differ from patient to patient. There are some patients with cerebral palsy with a very good cognition, very good attention span, but there are most of the coming to pediatrics, like pediatric cerebral palsy patients, they have cognition and attention span affected, poor eye contact again, and as we all know, the speech is equally affected, so it becomes very difficult for them to understand the day-to-day things, like starting from ABCD or maybe numbers. So then they are unable to go to school, so because of that their academics and everything, their understanding, cognition, it gets affected. Coming to mental retardation is basically a disorder when a psychologist is doing an IQ test and the test score is less than 74, then we can diagnose that person as having mental retardation. In mental retardation, usually what happens is non-performance in school. Again, the child is socially isolated.
The surgery is split into two parts. So first they extract bone marrow from the hip bone, which consists of a lot of stem cells. They need to extract around 100 ml of bone marrow, which is then subjected to purification and separation processes in the stem cell laboratory. In the laboratory, the stem cells are separated from the rest of the blood by using a method known as centrifugation, which is a density gradient process. They use raw mixture of mononuclear cells consisting of different stem cells, because instead of getting one benefit, it's like you're getting 4 benefits. The next part of the surgery is to inject these stem cells back into the body. Using a lumbar puncture needle, the stem cells are injected into the spinal cord and they have to travel through the cerebral fluid. This entire process consists of only suffering 2 injections and isn't a major surgical procedure. So how do these stem cells help to improve these disorders? So once these stem cells are injected into the spinal cord and into the cerebral fluid, they travel through the central nervous system. Now, these stem cells are intelligent enough to move towards the damaged area, and now they can do 3 things. First, they can either go and replace the damaged cells in the brain. 2, you could say that some cells in the brain are asleep, so they go and stimulate these cells to wake them up so that these cells can perform their function. Or 3, they can form blood vessels near the damaged area so that more blood and oxygen can be supplied to the brain. What is the role of a psychologist to improve these disorders?
See, whenever a child or any patient who comes to a psychologist is referred to a psychologist, has to undergo a psychological assessment. The psychological assessment is the first step. In psychological assessment, we take all the problem areas of the child into consideration. We take the detailed history, including the developmental history, the family history, schooling history, what is the present academic status of the child, and other problem areas into consideration, like the child's attention, concentration, cognition, the child's awareness and judgment, and the child's social interaction. After that, we do some psychological tests, like for autism, we use a childhood autism rating scale, and we also have some DSM-5 ADHD autism checklist, on the basis of which we can assess the child, and then we can plan an intervention plan accordingly. After the assessment, what we do is, now we have got a brief idea as to what is the issues and what are the problem areas. Then we refer the child to different therapists like occupational therapist, speech therapy, etc.
So